All right, so we're going to get into the pros section here and how we guide these implants or guide the prosthetics. So this is what an immediate implant looked like with a Tibase and a printed restoration. So this is the design process. You know, we designed this crown right in blue sky to be fit on top of a Tibase. We actually bonded the crown onto the Tibase prior to surgery. We chose the timing, we marked the timing, guided the timing, and then when they come in, literally just place the implant guided, make sure your timing lines up, and then screw the restoration right down and in. This is the file that I can send you guys if you want. These are the two desk Tibases that we use for our implants. This is the connection that works with our implant system. And most of the desk Tibases have kind of a short and a tall, so 1.5 or a 3 millimeter collar height. I don't love the shorter little big lip on these things. I like more of the smooth kind of trumpet design here. But it was kind of what we were talking about, placing deep, getting these implants put in deep and trying to use the longer one. But a lot of times you do end up having to use the shorter one. But these are great because you can have a bunch of these just in a tackle box, Tibase, put it right on with flowable. So when we're putting these guys on, we're just using a little flowable. And I think I have a picture coming up, but I'll show you here how to put them on with the flowable. And then you can cut them off real easily with the flowable. They don't bond onto the Tibase, but with the final restoration, you can bond it on. So it looks something like this. I'm going to kind of run through a few examples. This is just kind of a premolar here, where you just kind of can cap in a bone graft and use it to hold the tissue emergence. This is kind of an ugly picture here, but it'll show you when you put a big molar in here. Notice that by the time that scan body is on there, if you kind of notice how everything is collapsing. So if they've got just weaker, thin tissue here, it's going to collapse pretty quickly. So the key is, like, our lab likes 2 scans. They like a tissue scan and then a scan body scan. And that way they can use the tissue scan to get the emergence. So what we usually do is have the scanner all ready to go, and you just got to be fast. And so basically, you have your scanner on your pre-treatment scan, and you pull off the healing abutment. Assistant maybe hits it with some air, and you just scan really quick and get your tissue, and that holds the tissue. Then you can take a little bit more time. You can put your scan body on and get your scan body scan. And then your lab can use this for the emergence profile, and then the scan body for the data for the implant position. But you just got to be quick because it'll just collapse, and like that nice pretty emergence that you designed might shrink up. If they're a big, thick, fat ridge, it might not really move as much. Yeah, same kind of idea. These are the Forte implants. These are Blue Skies implants with a little bit bigger threads. So if you're trying to do some immediate load, these are nice implants. Same kind of idea, just a simple little sectional surgical guide. You don't need to wrap it all the way around. A nice little 3-tooth, 4-tooth is fine. Sleeveless, no metal. And then this is what it looks like on an x-ray. And you can see how deep, this was placed fairly deep. And this was an immediate, so I anticipate a little bit of bone loss. So I want the bone, and I'm kind of planning deep so that the bone ends up right in this area. And then you can't see the printed profiler, but it's on there. And that's what it should look like this is on an analog. So this is just seated on here with flowable. And there's this 3 millimeter tall Tibase. Here it is in the mouth. Now this one, even that looks fairly tall. So sometimes these things do stick up a little bit. So just make sure they're not an occlusion.